The proponent has been chosen.
Health Minister Tom Osborne isn't ready to name the private company that's won the contract, but CBC News has learned that it's called Teladoc, a U.S. company with operations in Canada. Osborne says the company has guaranteed access to virtual physicians, doctors who will be paid by the provincial health system with no out-of-pocket cost to users.
I will confirm that we have required that they be members of the NLMA as well as members of the College of Physicians and Surgeons of Newfoundland and Labrador.
He says the company will provide two types of services, 8 a.m. to 8 p.m. primary care for residents registered with Patient Connect and 24/7 virtual emergency department care with a nurse practitioner on the ground. Osborne expects both these services will be available by the end of November, with New West Valley being the first community to receive the 24/7 coverage. It's not clear where the physicians themselves will be based, but Osborne says it's possible that some of them could be doctors who are already working in Newfoundland and Labrador.
It's up to the proponent who they hire, but I don't see why they wouldn't be able to.
Opposition PC leader Tony Wakeham has questions.
We know all the challenges we've had with travel nurses and the extreme costs we're incurring because of that, and now we're going to go the same route. Is it because we just haven't done a real good job of retention?
Right now, health officials aren't saying how much the virtual care contract will cost the province, but Wakeham expects will pay dearly.
We all know that we will pay a premium for those doctors because now we're going to have the doctors in the same situation as the nurses. We've seen full-time nurses give up their full-time jobs to become travel nurses. Are we going to see the same thing happen now with our physicians who are currently seeing patients?
Osborne says this type of virtual care is not a temporary solution. And at a Board of Trade lunch yesterday, the Premier said there's no going back to the way the province's healthcare system used to operate.
If anybody stands on this stage and promises that everybody is going to have a family doctor in the next year or two or three, I would encourage you all to laugh them out of here.
Osborne said more details about virtual care coverage in this province are expected in the weeks to come. Mark Quinn, CBC News, St. John's.